Hey everyone, my name is Sienna Boyd and we are back in our Choose Health studio. This time we are with one of our newest physicians, Dr. Stephen Ching, who is our internist, who practices out of our Hemet office, which is super exciting. We're so happy to have you. Today we will be specifically chatting about vitamin D. I know that's kind of a weird topic. I know vitamin D is one of the biggest vitamins that we need in our body just for health. But we wanted to chat about it and just kind of debunk it a little bit and talk about why we need it. So, Dr. Ching.
Thank you for having me this morning, and I'm glad that you guys can join us as well.
Thank you. So tell us about vitamin D. Why do we need it? What does it do in our body?
So vitamin D, I'm sure we've all heard about it, vitamin D, and one of the most important things that we've kind of associated with vitamin D is actually one's bone health. And we might have seen this being advertised on TV or on the internet that vitamin D is an essential part of one's bone health. And that's what I kind of thought as well growing up.
Yeah. But in milk, they fortify milk with vitamin D, right?
Right. But it wasn't actually until college when I went to college in Riverside that there was a period of time where I actually wanted to look into doing research with one of the professors, and I was researching online on the school's website, and I came across one professor who actually had done a lot of research into vitamin D. He was actually one of the pioneers in terms of discovering how vitamin D acts upon the body, how it's absorbed, things like that.
Oh, cool. Okay.
And so I was reading more into his works. And from that, I kind of started to get a more better understanding that vitamin D plays more than a role in bone health, but it also can play a role in one's cardiac health, one's mental health. It can play a role in one's immunity and autoimmune diseases. Yes, actually, that kind of surprised me as well.
Yeah, well, because we're raised saying vitamin D is good for your bones, drink milk, fortified with vitamin D, at least that's what I've heard. And so hearing that it does even more, not just for my bone health, but also for immunity and mood, I feel like that's something that definitely needs to be talked about.
Oh, absolutely. And, that kind of garnered my interest in vitamin D and helped kind of introduce me to more benefits of making sure that one's vitamin D levels are in a good range.
Yes. I know. Actually, I was reading a study the other day, and it talks about how over 50% of Americans are vitamin D deficient, which is wild. So how does one get enough vitamin D, or where does it come from naturally?
Yeah, so that's a very true statistic, actually, that a lot of Americans and even much of the world is very deficient in vitamin D.
Weird.
Yeah, and vitamin D, surprisingly, you might be told that it's found in foods like dairy products and things like that. But surprisingly, it's very hard to get vitamin D by the kind of foods that we eat.
Interesting.
It's actually found more heavily in fatty fishes.
Really?
Yeah, like so. For example, swordfish, salmon, tuna. Those contain high levels of vitamin D. Yeah.
But if you're not a fish eater, you're not getting it from fish.
No.
Okay.
No, but some products that you mentioned already, like milk, fortified soy milk, almond milk, orange juice, those things are fortified because they're actually quite deficient in vitamin D.
Okay.
And so many foods that we encounter on a day-to-day basis don't really contain much vitamin D, and thus they've gone to make these products where they kind of fortify it with vitamin D.
And vitamin D is not something that we create naturally in our body. It's something that we do have to supplement, correct?
It's kind of both, actually.
Both. Okay.
It's both. We have to make sure we have a good intake, but as we mentioned, it's very hard to find foods, especially if you're not like a fish eater, to get enough vitamin D. And thus, there's supplements for that. But another important aspect of vitamin D that we often don't think about is actually our body needs sunlight to convert the vitamin D into a usable form in our body.
Interesting.
Yeah, and the sunlight is actually ultraviolet B rays that actually, when it hits our skin, it starts the the mechanism by which vitamin D is converted into usable form in our body.
Which that makes sense as to why people would be deficient then. One,
Mm-hmm.
because I know oftentimes people are like, don't go in the sun because of cancers and melanomas. So we definitely want to protect our skin from that.
Certainly.
But on the other side, you do need sun to get vitamin D for immunity, bone health, all of that.
Exactly.
So what's the balance that you're supposed to strike?
Right. So that's a great question. And, you know, in a day and age where we're always telling folks to, you know, stay out of the sun or at least wear sun protectant, it's actually the contraindicatory for actually getting vitamin D.
Yeah.
And so for us we live in Southern California, we have plenty of sunshine.
Yes.
But we have to remember that for other folks in other areas of the country,
right.
You know, for those who have like long winters or things like that, it's like they spend a considerable portion of the year without adequate sunlight. And
definitely, like in the Pacific Northwest where it's cloudy often, sun doesn't really penetrate through those clouds that well.
Exactly.
Now, when you wear sunscreen, does the sunscreen protect your skin from those rays that you need from the sun?
It does actually,
Okay.
yeah. The sunscreen protects from the ultraviolet rays of the sunlight. So, you know, it's kind of like a fine balance where we need to get enough of the rays, but not too much that can start to cause skin damage and potentially cancer.
So aside from the sun, you can get vitamin D from fatty fishes, from different kinds of food.
Correct.
How would one know if they were deficient in vitamin D? I have no idea. I live my life normally, but I'm sure I'm probably deficient. So how would I know?
Well, like for healthy individuals, vitamin deficiency is something that is very hard to know. Sure. Because it's actually, you don't really have any significant symptoms when you are vitamin deficient. Okay. And when you are vitamin deficient, the symptoms that you do have are sometimes very vague and non-specific. Okay. Commonly, you might be fatigued, or you might have some muscle aches or pains or discomfort. You might even have some mood changes. And all of those are very non-specific. It can be due to many other things. So definitely. And so as a result of that, vitamin D deficiency is something that's hard to really pick up. And we don't really focus that on a population that's more young. We start to focus on more for the elderly population because they're at more risk.
Okay, and why would the elderly population be at more risk for vitamin D deficiency?
Well, as the body ages, actually, you know, the body works in ways to help to make sure that vitamin D is in adequate supply. Okay. And so vitamin D relies upon one's gut, relies upon one's kidneys, bone structure, and one's skin, actually, because that's how it's being converted, and even some parts, the liver function as well. And you know, as one ages, these functions start to decrease. You know, one's gut starts to slow down, the absorption starts to be affected, and so that can affect vitamin D absorption. One's kidneys start to slow down in terms of its ability to filtrate the blood. And one of the important aspects of vitamin D is it maintains good homeostasis or equilibrium. And so having vitamin D is very essential for that. And if one's kidney starts to decline in terms of function, that can affect the vitamin D levels.
Definitely. Interesting. I know supplements are kind of a touchy subject. People sometimes think, no, you just need to get what you need from your diet. But it sounds to me that it's very difficult to get a sufficient amount of vitamin D from your diet. So supplementing with, is it like the over-the-counter supplements? Is it you can buy online? What would you suggest? Yeah, you can typically buy supplements over the counter. Okay. It's sold at various grocery markets or even pharmacies. And typically you might encounter vitamin D2 or vitamin D3. There's overall they do the general role of, you know, supplementing your vitamin D, but there is a slight difference. Vitamin D2 is more extracted from a plant-based source, whereas vitamin D3 is more from an animal source. So if you're vegan, vitamin D2 is the way to go, right? Typically, yes. Typically, yeah. And although vitamin D3 has been shown to be a little bit more effective as far as your body being able to absorb it and utilize it. Okay, that's
Yeah.
interesting and actually a great tidbit since
Yeah.
often we can go to the vitamin aisle and there's so many different options. You don't know
Exactly.
which one. So vitamin D3 has
Yeah.
been shown to be more effective.
Exactly.
I did want to touch on this because I'm very curious. You had mentioned that vitamin D affects mood. Can you touch on that a little more?
Certainly, and some studies have touched upon that. Vitamin D can affect mood in terms of like depression, and
Interesting.
yeah, depression can be affected by perhaps low vitamin Ds. And I don't know if this has a correlation, but as we mentioned, in some regions of the country, or where we don't receive a lot of sunlight, or where we have to stay indoors for long periods of time. Such as if it was during a winter time where it's snowing, where we have to be indoors. Typically, those types of seasons are associated with a more depressed mood.
Yeah.
Because we have to stay indoors and we're not able to really go out and socialize, and those can lead to what's called like seasonal depression.
Okay.
Yeah,
Yes,
so
I've heard that often. Yes.
Yeah, I wonder if there might be some sort of association with that as well.
Oh my gosh, I bet there is. I mean, I don't have any medical experience, but I understand how I feel and how I've seen my peers, and I've seen just when it does get a little more gloomy in California, the mood shifts.
Exactly.
But I know I've heard statistics about, like I said, in the Pacific Northwest or in different countries, like and in Amsterdam, for example, there is a different shift in mood, and I know the depression statistics are way higher than in places that are sunnier, which is really interesting. So
places near the equator actually receive more sunlight too.
Yeah. So a higher level or a lower level of depression, at least that's what we would see. So I'm excited for more statistics to come out about that.
I am, yeah.
We can touch on that again when they do come out.
Exactly, and that's why that's one of the age-appropriate screenings that we do in the clinic. Typically, and that goes along with like colon cancer screening, lung cancer screening, cervical cancer screening. The United States Preventative Services Task Force have come out with these guidelines stating that at these certain ages it's best that we look into these certain potential screenings that we can hopefully prevent the disease processes from occurring. And one of them is actually osteoporosis.
Oh, okay.
And so typically, like I said, as one ages, the bone kind of breakdown and formation starts to slow down, and the breakdown starts to outpace the formation. And when bone structure becomes compromised, it becomes more softer. It's more prone to fractures and breakage. And when it becomes soft, that's known as osteoporosis.
Okay.
When the bone density becomes less.
Interesting. Yeah, I've heard that thrown around a lot, actually.
Yeah.
And so when you get older and you are looking at preventative health scans, like you said, the colonoscopies, lung cancer screenings, what screenings would one do for bone health?
For bone health, actually, so for women, they would recommend undergoing what's called a DEXA scan. It's a specialized X-ray that visualizes your spine as well as your hip bones to assess the density.
Okay.
And so we can tell by the density of the bone structure if it's less dense to a certain degree.
Yeah.
We would label that as either being, it's a spectrum actually.
Okay.
There's a normal bone health, there's osteopenia, and then there's osteoporosis.
Okay.
And osteopenia is kind of like a pre-osteoporosis.
Got it.
And so by able to classify what it is, we're able to make the appropriate recommendations in terms of supplementing one's vitamin D appropriately.
Got it. And then you said that was primarily for women. Is there a different scan for men's bone health?
For men, it's the breakdown of bone is less rapid.
Wow. Okay.
Than women, especially because one's bone health is affected by menopause actually, and because women undergo menopause with a change in estrogen levels, they're actually more prone to developing osteoporosis, and that's why they recommend screening at an earlier age at 65, as opposed to men where they recommend maybe doing a DEXA scan or screening at age 70.
Wow, that is so interesting. It's interesting that both men and women can have such different bone health just depending on menopause and different causes. That's so fascinating.
Yep.
Well, Dr. Ching, thank you so much for giving us more insight into why vitamin D is so important.
Absolutely. I'm happy to always, be a part of this and be able to share some tidbits and facts about kind of everyday things that we encounter.
Yeah, thank you.
Mm-hmm.
Well, if you are interested in finding a new primary care physician, Dr. Ching is absolutely accepting new patients at our Hemet location. So you can give us a call and we can get you set up to meeting Dr. Ching in person and having an appointment with him. Otherwise, thank you so much, Dr. Ching, for joining us today.
Thank you for having me today, and hopefully we all learned a little bit something new today. Thank you.